So you're probably familiar with this, what I call the wavy nerve model, because it's actually giving you a lot more information regarding the bone placement and the muscle placement than that other flat nerve model. So we are looking most medially at the spinal cord here. Now what I also really like is you get to see the spinal cord coming down from the medulla oblongata, and there's your pons, and you also have some of your cranial nerves in here. So here we're not separating the brain and the spinal cord. So you're getting to see a lot more anatomical correctness. Quick fun fact, this is the internal carotid artery. When in doubt, it's the internal carotid artery. Now, a few things that I just want to show you here. We have got the denticulate ligaments in here. And then right here, we've got a pretty important nerve. That is the phrenic nerve coming out in the neck from spinal levels C3, 4, and 5. And it's going down to the diaphragm. So C3, 4, 5, keep the diaphragm alive. We've got these parts that are sticking out on either side. Those are the brachial plexes. That's gonna be C5 through T1. So if you get lost on this model trying to figure out spinal levels, that's a great landmark to have. You can count up or you can count down. Now moving down a little bit further, we've got this long yellow structure here with these little bulbs of peach. This is the sympathetic trunk, and the sympathetic trunk has sympathetic ganglia. So each of these is a sympathetic ganglion. We also have intercostal nerves right here between all the ribs. So intercostal means between the ribs. And then as we go down, we get a really nice view of a few of these more inferior structures on the spinal cord. So here's conus medullaris. And you can follow, as long as you're not going cross-eyed here, you can follow that it has got one single strand going down the middle. That is filum terminal, and I'm losing it here just because I'm getting a little dizzy looking at all those nerves there. All of these nerves that are around it, that's the cauda equina, the horsetail, one of my favorite structures. I think it's a pretty cool looking one. And then we've got some peripheral nerves that I want to remind you of. So these are going down into the lower limb for the most part. This first one up here is not on your list. It's called the subcostal nerve. So we can just ignore that, but good to know. Then we've got this one that has a common trunk, and it's going to branch into two different nerves. So this is iliohypogastric, and then the one that's a little more inferior is ilioinguinal. So when in doubt, remember that these two are alphabetical if you're feeling like you're getting them mixed up. Then we've got another common trunk right here. This is sitting on top of a muscle called psoas major. That common trunk is called the genitofemoral nerve. Now it does have two branches coming off of it. I want you to realize that this right here is called the femoral branch of the genitofemoral nerve, but it is not the femoral nerve. I repeat, this is not the femoral nerve. It's also not the right one that I'm pointing to. Wow. You guys can tell I've been doing these for a few too long today. Here's the femoral branch. This is the genital branch. Just forget what I just said. We're not going to edit that out because it's funny. Here's the femoral nerve. This is the actual femoral nerve. So over here on this other side, where we've actually got no muscle obscuring it, you can see much more of the femoral nerve. Now this one on either side that's swinging a bit more laterally, this is going to be the lateral femoral cutaneous nerve or the lateral cutaneous femoral nerve. Either one of those is an acceptable way to write that. Looking back to femoral, if we move a little more medial again, we've got this nerve that's going to course along the pelvis, and it's actually going to go through the obturator foramen. This is called the obturator nerve. And on the other side, we can see just a bit of that peeking out from under psoas major. Moving medially again, we get to the sciatic nerve. So remember, sciatic's always the really big one. And those are the primary things that you need to know on this model.